Good morning, everybody. This is Sue from Castle, and I'm also with Monique and Tracy, who are two phlebotomists who are also two of our TOLs out in the field. And today they are presenting phlebotomy supplies, trying to get us all educated on what these types of supplies are. And really, because I know blood and chemistry is new to all of us, so here's our opportunity to learn the difference of the different types of needles, the different types of tubes, so on and so forth. Also, as all of you previously know, I am recording this, but please, you should all have the ability to unmute yourself to be able to ask questions. If that does not work, please use the question section in the GoToWebinar sidebar and ask your questions, because questions are the process of learning. So with that, I'm going to turn this over to Tracy. Go ahead and educate us. Tracy, can you hear me? I might have muted you. Hold on one second. Tracy, there you go. You're on. Go ahead and talk, Tracy.
Okay. Am I unmuted now?
You are unmuted now. Don't know why I did that.
Okay.
Go ahead.
Good morning, everybody. Like Susan said, Monique and I have put this presentation together for everybody in hopes that it will give everybody an understanding who's just a little bit confused about some of the phlebotomy supplies. So as you can see on our first slide is our FedEx boxes, which is pretty much self-explanatory. We do, however, when we're dealing with blood, we want to make sure with any of our samples that the FedEx plastic bags must go inside of our FedEx boxes. FedEx will not pick them up if they're just in the bags. Especially with our blood, we want to make sure that they're well contained so those blood samples do not break and that they do have at least a diaper and 2 ice packs in them prior to shipping them out to our FedEx for home office. Next slide, Monique. Okay. Again, this one is pretty much self-explanatory. Shipping label must be placed on the outside of the box when shipping anything to home office. Biohazard stickers should go on along with this label if shipping blood to home office. Next slide. This is our FedEx clinical pack. This is where all of our specimens must be placed inside this bag prior to going into the box with a gray diaper or absorbent pad. Next.
Tracy, can I say one thing? I just wanted to remind them on the prior slide that if they can make sure that their phlebotomist knows to record the 12-digit tracking number, and then that something happens with it, it can be shipped. I mean, it can be tracked.
Awesome. Yep. Okay, now this slide is going to explain FedEx versus Curio pickup. As most of us all know, getting FedEx to pick up can be a little bit difficult if we don't have enough samples going out. We might have to have home office set it up where we have somebody coming to pick our samples up that will be able to ship them back to home office in a timely manner. Please notify of any frozen specimens that Castle needs to be aware of with dry ice packs to transfer specimens while maintaining specimen stability. If the specimens are not picked up from inside the office, please make sure that they are placed outside of the doctor's office in a secured lockbox. I know not every clinic has these, but if they have a carrier picking up, this will be supplied. Ensure that you place at least 2 to 4 ice packs inside of the lockbox with the specimens, depending on the number of specimens that you're going to be shipping out for that day. Also keep in mind that now that we're going into the warmer temperatures, for our specimens to be sitting in these lock boxes, you're definitely going to want to put more than 2 to 4 ice packs in, just to reassure that our samples are not contaminated by the heat in any way. And definitely ensure that the carrier will pick up and coordinate with the office schedule's work hours. This is very important, so if they don't pick up, our samples are going to be sitting there the next day and our specimens are going to get compromised. Monique, do you want to add anything to this one?
No, just the only thing is to ensure that the specimen are shipped the same day, because there has been some instances, I think only in extenuating circumstances should the specimen be held an extra day for shipment the following day.
Okay, next slide. Biohazard sharps containers. This is the container where all of our used needles and our tubes of blood, if for whatever reason one breaks open, the top comes off, those all need to go into this biohazard container. Do not put papers and things like that in biohazard container at all. These are for our sharps, and they have a lock top on them. So once the biohazard tops are full and they go to the full line, this secures our collectors or anybody else in the doctor's office from getting poked by a needle. And please, 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 I cannot stress enough, do not ever stick your hands in these sharps containers to retain something that you've accidentally thrown in there. You will get stuck by a needle, and we definitely do not want that. Next slide. These are also biohazard containers. These are the different sizes. Depending on the volume of blood that your clinic is going to be doing will determine what size sharps container that you will need. They go anywhere from 1 pint, as you can see, all the way up to 2 gallons. If you do come across a clinic that needs a bigger 2-gallon, please let Miss Susan know, and we will make sure that that clinic gets a bigger sharps container. Next slide. Okay. All right. Common used names for our SS tube, which is also known as a tiger tube, a serum separator tube, a gel barrier tube, and a marble top tube. This serum separator tube is used for serum determinations in chemicals, chemistry, and serology. It contains separating gel that should not be used for toxicology or drug testing. I'm sorry, guys, I pulled out my own words. This will go into your centrifuge. It must sit for 30 minutes and then must be in centrifuge for at least 10 minutes to spin in order to separate the blood from the serum. And please make sure that when your phlebotomists are drawing blood, that the blood does sit at least for 30 minutes. Anything you need to add, Monique?
No, ma'am.
Okay, next slide. Okay, this slide is our common ordered panel in SS tubes. It goes anywhere from basic metabolic panel to electrolyte panel. The common order involved in an SS is, as we all have listed, ANA, CRP, calcium, CEA, cholesterol total, ferricite, glucose, iron, magnesium, potassium, and so on. Most of our clinics are using the Tiger Top for vitamin D. So if you do have a clinic that's drawing blood and they are doing vitamin D, this is the panel that they're going to use. It's definitely going to go in the SS tube. Next slide. Yellow SS tube. Now this is going to kind of throw everybody. This tube can also be used in place or along with the Tiger Top tube. It's the same tests that go in the Tiger, but it can also be placed inside of this gold tube. Any questions on this one, Monique, that you want to add?
No. I've just, in my experience, I've never used the gold top within a physician's office. I've known these mostly to be used in the hospitals, but I have heard some people say that they have used them within a doctor's office. So,
yeah, I think, to be honest, I think the gold SS tube would be the preference of that doctor's office. I myself, like Monique mentioned, I've never used the gold SS tube myself either. So it's just going to be a preference on what the doctor wants. Next slide, please. Red top tubes. These tubes are a plain Vacutainer. There is no anti-coagulation at the bottom of this tube. It is also used for therapeutical drug levels. In other words, if you have a patient that you can't get urine or saliva on, you can draw their blood using a red top tube. These must be placed in the centrifuge for at least 15 minutes, separating the serum from the cells. Platelet the serum into a clean plastic screw cap vial. In other words, you're going to transfer the serum into a separate vial, label that transfer vial with the patient's name, date of birth, and the serum, and it's very important that you list the specimen as serum. This is not going to be listed as blood because obviously it's not going to be blood. It's going to be listed as serum. Next slide. Commonly ordered tests in a red top tube is going to be cholesterol, potassium, BUN, known as BUN, your liver enzymes, lithium, and so on and so forth. I don't know if many labs are using red tops right now, but I'm sure that they probably will be getting into that the more and more that Castle gets into blood draws. So please keep in mind that when you are ordering a liver enzyme, cholesterol, they must go in these red top tubes. If you put them in the Tiger tubes, home office is going to, could possibly reject that sample because it's in the wrong colored tube. Next slide, please.
And I'd just like to add to that, on some of those tests that are listed here for the red top, like the amylase, potassium, and cholesterol, those can also be drawn in the SST tube. It just depends on, I guess, the phlebotomist preferences. But like with the valproic acid, which is also called the Depakote, it has to be drawn in the red tube because the gel separator that is in the SST tube, it interferes with the testing. So some of the tests can still be drawn in the SST tube, but there are certain ones that it'll plainly tell you it has to be drawn in the red tube without the serum separator so that it doesn't interfere with the accuracy of the testing. But if that's ever a question, you can always call Castle and get clarification on that.
Our lavender or purple tap tubes. This tube contains EDTA, which is the potassium salt, or K2-EDTA. This is a strong anticoagulant, and these tubes are usually used for completing blood clotting, such as CBCs. These tubes are generally used when whole blood is needed for analysis. Note that after the tube has been filled with blood, immediately invert the tube several times, usually 8 to 12 times, to prevent it from coagulating. Sometimes the test requires the specimen to be centrifuged and the plasma is separated from the blood. When necessary, separate the plasma and transfer the plasma into a plastic transport vial, labeling patient's name, again, the date of birth, and also EDTA plasma. Next slide, please. Okay, common ordered test in a lavender tube is CBC, amino, B-type, which is BNP, hemoglobin A1C, stud rate, RBC, and white blood count, hemocrat, and sickle cell screening. Now this one can, okay. Now please keep in mind that we've only added the main ones that a doctor could possibly want, but if you have any questions, again, on which blood goes into a lavender tap, please reach out to home office. Next slide, please.
Okay. And I just want to point out that if the office is ordering a BNP or either a PTH and it's drawn in the lavender tube, then you need to centrifuge it and separate the plasma from the whole blood using a pipette, and again place it into a plastic transport tube. And as she stated earlier, if it comes off the SST tube, then it should be labeled as serum, but if it comes off the lavender tube, then it should be labeled EDTA plasma, because unfortunately plasma and serum looks just the same. So if the specimen is sent in and it's not clearly labeled, then there's going to be confusion once it arrives at the laboratory.
Light blue taps. The light blue tap, this tube contains sodium as anticoagulant used for drawing blood for coagulation studies such as PT, PT-T, and PT-INRs. Now, please keep in mind, again, after this is drawn, invert it 6 to 10 times to activate the anticoagulant. If the test requires the plasma to be transferred, definitely put it in the centrifuge, transfer to a plastic transport vial, label with patient's name, date of birth, and it's really hard to read that.
Citrate plasma.
Okay, thank you. Now keep in mind too that on these light blue tubes for PT and PT-INR, a lot of these the doctor is going to order a stat report on. Doctors do these tests for patients that are on Coumadin and they might be going in for surgery, so they definitely need to find out what their coagulation reading is. So please keep in mind that if you do have a phlebotomist drawing a light blue and the doctor orders stat, please put red stickers that say stat on there so home office can run them immediately to get those test results back to the doctor in a timely manner. Next slide, please.
And if we could just make sure that the phlebotomist knows that this tube needs to be completely filled, because of the ratio to blood to the anticoagulant is critical for getting valid results. And if you send in a tube that is half full, then it can result in the specimen being rejected. So it's very important that this tube is filled at least 90%.
Commonly ordered tests in the blue tab, again, is PT, INR, PTT, and PT, which is, again, a lot of these are going to be ordered as stat reports. Next slide, Monique, please. Our gray top tubes. Our gray top tubes are commonly ordered for glucose levels, blood alcohol levels, lactic acid, and bicarbonate. Is that one correct? It's really hard to see.
Yes, bicarbonate.
Okay, I just wanted to make sure. Again, this tube also needs to be inverted 4 to 5 times after collection to allow adequate mixing of the blood with the additive to prevent coagulation. Next slide, please. Our green top tubes. These tubes contain sodium, harpin, or sodium lithium used for the collection of heparinized plasma or whole blood for specimen testing. After the tube has been filled with blood, immediately invert the tube several times to prevent coagulation. Commonly ordered tests for this green tab are chemistry tests on plasma, amino, carboxyl humbolin, stat electrolytes, and chromosome screenings. Sorry guys, I'm like really nervous. Next slide, Monique. Royal blue top tube. These are 2 general types of this tube. One which is K2, and the other one which is with no anticoagulant. This tube is used primarily for trace of metalloanalysis, primarily used for the following: toxicology, nutritional chemistry testing, and tracing elements. Next slide. Our yellow top tubes. Our yellow top tubes are used for solution A or solution B. This tube is used for drawing whole blood for special tests. Tubes with ACD are for cellular studies, HLA type, and parental testing. Next slide, please, Monique. And just to touch base with our blood tube specimens, since we're moving on to our toxicology right now, please keep in mind and let your collectors/phlebotomists know that when drawing blood, it's really important for them to draw, I would say, at least 2 to 3 tubes of blood, just to make sure that once everything is spun down, if necessary, that home office will have enough serum to be able to perform every test that goes on that rec form. So we don't want any tests coming back and saying, oh, well, it was an inadequate specimen because there wasn't enough blood. Please stress to your collectors/phlebotomists that they draw at least 2 to 3 tubes of blood to ensure that none of the tests and all of the tests that the doctor ordered gets covered. Monique, do you want to touch base on that one real quick?
I think you covered it very well.
All righty. All right, moving on. Our sterile cup specimen. This is our orange top. Sterilization cup, pretty self-explanatory. Most of us have come to know this cup extremely well. Please, when a patient urinates in this cup, that the top of it gets screwed back on extremely tightly prior to shipping to reassure that no urine gets leaked out in hopes that the specimen would get rejected. Please make sure to place the patient's name, date of birth on the urine cup. Next slide, please. Urine collection and sensitivity tube with urine transfer straw, known as CNS. This is going to be used, the urine transfer straw is a non-sterile plastic holder device that contains a needle with a straw attached that can be used with most urine collection cups to fill the evaluated CNS tube. This tube should be used when a physician has ordered a urine culture and sensitivity test. A CNS tube has a light gray stopper with prevention in the bottom. The tube has a minimum draw line. Once the tube is pierced by the needle, the volume will automatically draw into the tube. Be sure to label the tube with the patient's name and date of birth. Next slide, please. Urine transfer container. This is a flip-top container that can be used to transport urine to the laboratory for a urinalysis. The top is secure and locks in place for preventing leakage of the specimen during transportation. I believe this one is new for all of us. Are we going to be using this one?
The thing that I've noticed with when we're using the urine cups is even you can put the top on there really tightly and it still tends to still leak. And once it gets there, the bag is full and all of the urine has leaked out of the cup. So this is what I have been using because I do a lot of urines, and once you pop the top, it opens up, and then when you push that little lever down there, and then it'll lock it in place. And I haven't had an experience with any of these leaking. So it's just a way to prevent, you know, the urine from leaking from the sterile urine cup.
Okay. Next slide, please. Okay, 24-hour urine jugs, 24-hour timed urine collection procedures. When you get up in the morning, this container is used to empty your bladder by desiccating the urine and putting it in this jug. This will be your starting time. For the next 24 hours after your first void, collect all urine and carefully pour into the transfer urine collected each time into the large gallon jug. Mix the jug after each additional of urine. So in other words, if a patient has to do this, they're going to urinate, transfer the urine into this, but every time that they add urine, they're going to mix it. And they have to keep this into the refrigerator. At the end of the 24-hour period that the patient empties their bladder, collect the urine and add it into the gallon jug, record this as your ending time, and off to the doctor you go. Bring the 24-hour jug and the times you record to the clinic on the day that that the collection was completed. Next sample. Next slide, please. I hope she holds on. Our toilet urine hat. Toilet urine hat collection is a urinary accessory commode specimen collection. It is a unit used for the collection of urine and stool samples or kidney stones. And this fits over the toilet, and the patient does his or her business, and then they will transfer it. Then they will transfer it into the proper specimen cups. Next sample. Next slide, please. Common venipuncture needles, gauges with needle types, and topical used in venipuncture. We currently have a 21 gauge needle, 22 gauge, 23 gauge, and 25 gauge. Never reuse a needle, never use if the shield is broken, and never recap, cut, bend, or break a needle. The size of the needle is indicated by the gauge. Larger gauge number indicates smaller needle diameter. A 21 or 23 gauge needle routinely is used for venipuncture. Note the slide that shows outlining each needle gauge and their uses. That's going to be on the next slide, please, Monique. And here's our parts of our needles. This slide outlines the parts of the needles. The bevel is always face up when inverting into a vein. The shaft is the select invert into the vein. The thread hub is where the holder is screwed on to the needle. The rubber sleeve pierces the tube once it is placed inside the hub during the venipuncture. Next slide, please. This is our 21 gauge beveled Vacutainer Eclipse needle with hub or holder, and these are pre-assembled. This is considered the standard venipuncture needle for routine venipuncture on a patient with normal veins or syringe blood culture collection. This needle also includes the safety device, which is enlarged by the lifted of the pink plastic pierce over the used needle before disposing into the sharps container. Next slide, please. A 21 gauge needle without the hub or holder. This is basically going to be your needle. Some of you will see this if you don't have the hub or the holder. This needle requires the attachment of the hub or holder. The hub or holder is screwed onto the threaded end of the needle where the rubber sleeve is located. Then this will pierce the tube as they are placed inside of the holder. Next slide, please. Disposable tube holders. This device is designed for single use only. Please do not reuse these. Common use names for this is a hub, a holder, a needle holder, a tube holder, or an adapter. Next slide, please. Assembling of needle and hub/holder. The tube holder / Vacutainer adapter. You have the bevel, the shaft, the threaded hub, and the rubber sleeve over the needle. What you're going to do is you're going to take the tube holder, connect the tube holder with the needle, make sure that it is screwed on tightly, and then you're going to assemble the whole system by putting the evacuated tube in place. Next slide, please. 21 gauge bevel, 20 and 22 gauge bevel vacuum eclipse needle with hub and holder. We also have 22 gauge vacuum eclipse needle without hub and holder, and we wanted to show you that the 22 gauge beveled vacuum Eclipse needle with hub holder, that's how they will be shipped out as one unit, versus the 22 gauge without hub. They will be ordered or come to you separate without that hub. So we wanted to make sure that everyone understood the difference between hub holder versus without hub holder. Next slide, please. This slide is use of our 22 gauge needle. This 22 gauge needle is used on older children, adult patients with small veins. Next slide, please. 23 gauge push button butterfly needles, most common size butterfly needle. This butterfly needle is used on veins for infants and children. It is also used on difficult draws or hand veins for adults. And our 21 gauge push button butterfly needle, this butterfly needle is used in the is the same gauge as the straight needle. It just is in a butterfly form. Depending on your phlebotomist / collector, they might have a preference to using a butterfly rather using the straight needle. Next slide, please.
And the only thing that you have to do to engage the safety on those is a push button on the top, and once you push that button, then the needle just retracts back in.
Our tourniquet. Our tourniquet is a constricting or compressing device, which is like a bandage. It uses to control the venous and arterial circulation to an extreme for a period of time. What you're going to do is our phlebotomist / collector is going to apply the tourniquet 3 to 4 inches above the collection site. Never leave the tourniquet on for over 1 minute. Next slide, please. Scientific no-touch one-slide pap smear kit, as some of us have come to know over the years. The no-touch specimen pack provides maximum slide specimen protection. Ventilation folds allow wet slides to dry in carrier pack. Next slide, please. Our BD SurePath liquid-based pap test. This cytology sample is collected using one of the following: a broom-like device with a detachable head, a combination of brush or spatula with detachable heads. Next slide, please. A brush and spatula. Brush and spatula, again, it's going to totally depend on the doctor's preference. Some doctors might want the brush and spatula, and some might just want the broom with detachable head. The brush and spatula used with SurePath and Thin Prep kits, and the broom is used for SurePath and Thin Prep kits also. So both can be used for the exact same thing. It, again, is going to depend on the doctor's preference. Next slide, please. Our Thin Prep pap kits. As you can see, our Thin Prep, again, is in the last slide. You can use either the spatula in the broom or just the broom. Again, it's going to be the doctor's preference on which one he or she prefers. Next slide, please. Papera Pack Culture and Sensitivity Stool Kit. I know most of you are saying ew, but again, this is used for purposes of a stool sample. Stool samples are fecal samples that are going to help diagnose certain conditions such as parasites, viruses, or bacteria, poor nutrition, absorption from cancer, or if a patient is complaining that they have blood in the stool. This is definitely what the doctor would be asking the patient to be using. Next slide, please.
Okay, and for the collection, you'll just make sure that you collect the stool in a clean vial or either like a urine or had, and we'll show a clean vial on one of the other slides, and then you'll use the white part at the end of the top to transport no more than 1 ounce of the specimen using the spatula into the vial and make sure that it's mixed thoroughly.
Pepper Pack Oval and Parasite Stool Specimen Collection Kit. A stool, oval, and parasite test is used to detect parasites and eggs in the intestines. The collection instructions: you're going to pass the stool into a hat or a clean container, collect the sample of stool with a collection spoon provided in the cap or the container, place enough stool in the vial so the liquid reaches the full line. Do not overfill or mash the stool specimen. It is thoroughly specimen until it is thoroughly mixed with the liquid. Use a second vial spoon and repeat step 2 with the other vial if a second vial is needed. Label the specimen with name, date, and time of the collection. Next slide, please. Pepper Pack Clean Vial for Stool Specimen. Stool transfer vial without preservations. A 30 ml leak-proof vial for transport of specimen that do not require a transport medium. The vial contains a built-in spoon for safe and easy manipulation for the specimen. The specimen vial is used for collecting stool samples for tests which cannot have preservations. Example for testing requires unpreserved stool. This is for clotting blood, H. pylori stool agents in fecal fats. Next slide, please. Transystem sterile transport swabs. Anaerobic multi-purpose transport system. A sampling site that may be tested using a swab, including the following. These will be used for throats, vaginal cultures, wound cultures, skin cultures, male urethra, most commonly used to eliminate strep throat and things like that in children as well. It can be used when testing of the following for gonorrhea and streptococcal. Next slide, please.
Okay, what? Okay.
GenProbe Aptima Urine Specimen Collection Kit. Specimen Collection Kit. Once urine is collected, transfer to the yellow GenProbe urine specimen collection vial, being sure to put enough urine to fill the line. This test is used for chlamydia and other STD testing.
I want to add one thing. This is Sue. This is not our collection kit for chlamydia and gonorrhea. This is basically anybody else's who, any other labs. This is the type of kit that they would be using for chlamydia, gonorrhea, but this is not the Abbott one that everyone is receiving. So I just wanted to clarify that. This is not what we use for our chlamydia, gonorrhea testing. Go ahead. I'm sorry. Go ahead.
Next slide, please. GenProbe Aptima Unisex Swab Collection Kit. With this, you're going to remove the cap from the swab specimen transport tube and immediately place the swab inside the tube. Currently break the swab shaft at the score line. You're going to recap the swab specimen transport tube and make sure it's secured tightly, label, and ship. This kit is used for STD testing in males and or females. And as you guys can note, one is pink and the other one is blue to separate male and female. Next slide, please. GenProbe Aptima Vaginal Swab Specimen Collection Kits. This collection specimen is following urine or a swab collection procedure. You're going to place the specimen into the transport tube, label the specimen tube, and send to the laboratory. This test is used, again, for any STD testing. Next slide, please. Our throat swab culture. A throat swab culture or throat culture is a test commonly used to diagnose bacterial infections in the throat. These infections can include strep throat, tonsillitis, whooping cough, and meningitis. A swab sample can also detect thrush, bacterial vaginitis, and various other germ bacteria which are not sexually transmitted infections. This swab can also be used for wound cultures. Collecting a throat culture using a sterile cotton swab, the doctor or MA would swab the patient back of the throat on each side. They're going to carefully place it back into the tube, put the patient's name on it, date of birth, and they're going to ship it out to get that report back from the lab. Next slide, please. Our glucose drink. This drink is given to pregnant women to check for gestational diabetes during a pregnancy. The drink comes in the following: 50 grams, 75 grams, or 100 grams. The patient will drink the 50 gram, it's an hour, the 75 is 2 hours, and the 100 gram is 3 hours, depending on what the doctor orders. Next slide, please. Pre-filled formula container. This pre-filled formula container is designed for safety collection, preservation, and transportation and strong of specimen or various, and it comes in various sizes. The most common used size are 20, 40, 60, 90, or 120. It's used to transport tissue specimens. Next slide, please. Amber vial transport tubes. These vials offer protection. They are amber because they have to be protected by light. Some tests require that the specimen is protected from the light. An example of this test requires shipment in an amber vial, and this is vitamin B6. In the event that you do not have access to an amber transport vial, Wrap the specimen with aluminum foil to protect it from light seeking in, being sure to label the foil with the patient's information. Next slide, please. Plastic transport vials. These vials are used to transport serum or plasma that has been separated from whole blood and needs to be transported into laboratories. Please make sure that you write the patient's name and date of birth on these transport vials. Next slide, please. Blood transfer pipettes. Blood transfer pipettes feature large bubbles and are commonly used to transfer blood to and from tubes and vials. As we talked earlier, this is what Monique said: when you have to transfer your serum, you would use these pipettes to separate the serum from the blood and make sure that the serum gets put in the proper container. Next slide, please. Our alcohol prep pads, again, this slide is pretty much self-explanatory. Alcohol prep pads are used to clean the venipuncture sites. Next slide, please. Our 2x2 gauze pad, pretty self-explanatory as well. These gauze pads are used to place on the venipuncture site following the collection of the blood. This site should be allowed to air dry and should not be dried with a gauze pad. Next slide, please. Our test tube racks. Our test tube racks hold the blood once it is drawn. Our collectors are going to place the tube in the rack while allowing the specimen to clot. This rack improves organization and efficiency during the phlebotomy. Next slide, please. Our biohazard stickers. Our biohazard stickers, these are our stickers that would be placed on our specimen box prior to shipping to allow FedEx and Home Office to know that there is going to be blood inside of the containers. Next slide, please. Our biohazard bags. These are essential when using and controlling the spread of diseases from human waste. Discard all medical supplies and biologic containments. This is where our collector/phlebotomist would put used gauze, cotton balls, anything that contains any type of body fluid would go into these biohazard bags. Again, no paper can go in them, no glass, anything like that. These red bags are used to contain and store test tubes, cotton swabs, and only glass slides. I would not suggest putting a tube of blood in there. That should be going in the biohazard container. Next slide, please. Our biohazard specimen bags, again, this one is pretty much self-explanatory. These bags are marked with a biohazard symbol, and they have a Ziploc seal to prevent leakage. There is a separate document pouch that keeps documents separated from the samples. Please make sure that these are clean and closed to the specimen in transport and storage. Next slide, please. Our centrifuge. This is what the blood is going to be placed into after it has sat for 30 minutes. You're going to place that in the centrifuge, and you're going to spin the blood to separate the serums as needed. Next slide, please. Disposable lab jackets. Our disposable lab jackets, you would definitely want our collector phlebotomists to wear just to make sure that if an accident does happen, our collector / phlebotomist is not exposed to any harmful agents at any time. So I do recommend everybody ordering some of these. The disposable jackets can withstand wear up to 5 to 10 times. But obviously, if you do have an accident, I would definitely dispose of it and get a new one. But this, I would highly recommend lab jackets. Next slide, please. Soft tape or paper tape. Soft tape or paper tape can be used to apply to a venipuncture site along with gauze after blood draw is performed. It is often used as an alternative to Band-Aids. Now please keep in mind that you might have an elderly patient where they can't use the soft tape, they have to use the paper tape because when they take it off, their skin might tear because it's really thin and stuff. But that is going to be on a patient-by-patient evaluation from the collector / phlebotomist. Next slide, please. Reusable ice packs. Our ice packs are used during the transportation of blood to help with the stability of the specimen while keeping the specimen chilled. It is very important to use the ice packs when shipping via FedEx or when placing specimens into an outside lockbox. Next slide, please. Our phlebotomy tray. A phlebotomy tray can be used to help better organize the phlebotomist's supplies. It is also used when traveling between exam rooms while in an office, placing everything at the phlebotomist's fingertips. So your phlebotomist should never have to leave the room to go and get anything. He or she's supplies are always going to be at the tip of their fingers at all times. Next slide, please.
That's it.
Wonderful. Thank you both, Monique and Tracy, for putting this together. I know that it was nothing about excitement or anything like that, but it's just some basic great information that all of us need to have regarding the phlebotomy supplies. This webinar, again, has been recorded. You can review it. I'm also going to make the presentation available on the website for your reference, such as there's lots of actual information on the PowerPoint that hopefully you can reference to for future knowledge. So thank you again. Does anyone have any questions for Tracy or Monique? Hold on one second. I just have a couple things here that actually two of our TOLs have mentioned. We use this for the collection blood sample here in Texas. I know Janidra mentioned that earlier. It was about a particular tube. Becky has a question here. Instead of a tape, can we order some of the sponge stitch wrap for patients? Becky, can you take yourself off mute and just elaborate on that question? Becky, you should be off mute. Go ahead, Becky.
Can you hear me now?
Yep, I can hear you.
Okay, great. Well, what this is it's a it's like it's spongy, it's stretchy, it comes in different colors. It comes in tan or white. Well, I've never seen white, tan, or fluorescent colors. But instead of using tape, you just wrap it around the arm a couple of times, and it holds the 2x2 in place.
Yeah, you're talking about the Kofax.
Is that what that's called?
It looks like a stretchy, reusable ace bandage.
Yeah, it's like a bandage, but you just,
Yeah,
yeah.
you can also use that as well.
Okay, cool. Well, I mean, do we have it?
Yes, we do.
Okay, all right.
Excellent. Ron, you have the
Why
question.
they added to the slide is because that Coflex or Coband is really expensive, and I didn't know that they wanted it added to it, but it is very good to use, especially when you're drawing blood on the elderly, because it doesn't tear their skin. And it also
Right,
helps
absolutely.
because it's a pressure wrap, it helps with bruising.
Perfect. Ron Stewart has a question. What would a typical order be to get a new client new clinic started? Can you guys address that for Ron?
Say that one more time.
What would a typical order be to get a new client started?
To get a new client started, home office has put together a blood kit that they do send out. They are going to get everything from butterfly needles to paper tape. They will get, depending on what the office is going to be drawing, for example, if they're only going to be drawing Tiger Top tubes, then Tiger Top tubes are going to be sent to this clinic. Home office will make sure that they get everything that they need to get that clinic up and running. And
Well,
then once they start sending in...
I want to clarify that, Tracy. Moving forward,
Absolutely.
home office isn't going to be sending anything automatically regarding supplies. This was discussed last Thursday during our new client implementation process, that we are not sending supplies in a welcome kit any longer. This is the TM or TOL's responsibility to teach in that same aspect of, hey, okay, you're a new client. Let's log on to our supply website, place your initial order for your first supplies to arrive. And this is a list that Monique is showing here, which is some standard supplies that would need to be ordered in that initial order, Ron. And this is for anyone. So again, this is a good opportunity at that moment when a new client is boarding and then you need to make that initial order, is for you to communicate with the collector, the phlebotomist, the office manager, whoever that point of contact be. And we can supply this list. I think we have in the past, so I can supply it again. And let them look through this. What supplies do you need from Castle? And they can really indicate, and then you can show them how to place those orders online. So just initiate that again. Castle is not sending any supplies automatically any longer, because they really were just received not in a good light because there's just so little of them. So we really need the TMs and the TOLs to work with those new clients, discuss the supplies, what do you need, what quantities do you need, and place that initial order. This is, again, your opportunity to train them how to place an order online, and then the customer service will process that as standard. So just want to initiate that.
Perfect.
Any other questions? Wonderful. Again, if anyone else has any questions, please feel free. You can reach out to myself. I can direct them to Monique and to Tracy. We can get those answered. I will make that list available to everyone in the Cascade, so you have that standard idea of the phlebotomy supplies. So you're going to have that knowledge as well as this presentation all available here. And again, I'll make them all available on the portal. So again, thank you all for attending. I know this was a long one, but there was a lot of supplies to go over. And thank you, and have a wonderful day.